Welcome to my channel all about nursing world. I hope you all are doing well, and today's video is going to be about
Oxygen therapy. In today's discussion, we will discuss about the conditions for which supplemental oxygen is used, recognize the different type of delivery systems for oxygen therapy. We'll explain safety consideration for the use of oxygen, identify the precautionary measures when using an oxygen cylinder in the ward. First of all, what is oxygen therapy? It is the administration of oxygen as a medical intervention which can be for a variety of purposes in both chronic and acute patient care. Oxygen is often prescribed for people to prevent hypoxia because of the following conditions: difficulty ventilating all areas of their lungs, impaired gas exchange, heart failure, etc. Indications for oxygen therapy can be tachypnea or dyspnea. Tachypnea can be in certain conditions such as cyanosis, restlessness, disorientation, cardiac arrhythmias, slow bounding pulse, tachycardia, hypertension. Dyspnea can be in coma, labored breathing, lethargy, tremors, or seizure activity. Clinical goals of oxygen therapy are to treat hypoxemia, to decrease the work of breathing, to decrease myocardial work. Factors that determine which system to use are patient comfort, the level of FiO2 that is needed, the requirement that the FiO2 be controlled within a certain range, the level of humidification or nebulization. Oxygen therapy to ensure safe and effective treatment. Oxygen is required for the functioning and survival of all body tissues, and deprivation for more than a few minutes is fatal. In immediately life-threatening situations, oxygen should be administered. Hypoxemia, acute hypotension, breathing inadequacy, trauma, acute illness, CO2 poisoning. Severe anemia during the perioperative period. Oxygen supply, piped in wall outlets at the client's bedside, or can be used in tanks or cylinders for transporting oxygen-dependent clients in home use. Humidifier, add water vapor to inspired air because oxygen is a dry gas that dehydrates respiratory mucous membrane. It prevents mucous membranes from drying and becoming irritated. It loosens the secretions for easier expectoration. Devices used for administration of oxygen are pressure regulator and flow meter. Oxygen delivery systems are beginning from the lower to higher. We will start with nasal cannula. It is having We will start with nasal cannula. It is a thin tube with two small nozzles that protrude into patient's nostrils. It is most common and inexpensive device. It delivers 2 to 6 liters per minute of oxygen with a concentration of 24 to 45%. Simple face mask. Simple face mask covers the patient's nose and mouth. Exhalation ports at the side of the mask allows to exhale CO2 to escape. It delivers 5 to 8 liters per minute of oxygen with a concentration of 40 to 60%. Number third, Venturi mask. It has a wide bore tubing and color-coded jet adapters. It delivers a range of 24 to 50% of oxygen with a concentration of no. It can accurately deliver 24 to 50% of concentration of oxygen and at a rate of 4 to 10 liters per minute. Partial rebreathing mask. It has a reservoir bag which increases the provided oxygen rate to 60 to 90% of concentration and a rate of 6 to 10 liters per minute. Non-rebreather mask draws oxygen from an attached reservoir bag with one-way valves that direct exhaled air out of mask. Next is face tent. It can replace oxygen mask when masks are poorly tolerated by clients. It provides 30 to 50% of oxygen concentration with a flow rate of 4 to 8 liters per minute. Bag valve mask or AMBU device. It is a malleable bag attached to face mask or invasive airway such as endotracheal tube or laryngeal mask airway, usually with a reservoir bag attached, which is manually manipulated by the healthcare professional to push oxygen into the lungs. That's why it's called artificial manual breathing unit, that is AMBU, used in many emergency medical services and first aid personnel. As you can see, the parts of an AMBU bag. So to summarize, here I have listed all the 6 oxygen delivering systems, the amount of concentration of oxygen it provides, and the rate of oxygen it delivers. What are some safety precautions that are to be kept in mind while using oxygen? Keep electrical equipment more than 1 foot away from where the oxygen flows to your face or breathing tube. Do not stand oxygen cylinders upright unless they are well secured. If the cylinder falls, the regulator or valve could become damaged or cause injury. Do not drag or roll cylinders. Do not carry a cylinder by the valve or regulator. Do not hold in on to do not hold on to protective valve caps or guards when moving or lifting cylinders. Do not deface all do not deface or remove any labeling or markings on the oxygen cylinder. Never use oxygen without a safe regulator that fits properly. When the tank is not in use, keep valves closed even if the tank is empty. Do not store oxygen cylinders near flammables or hot water heaters near electric or phone boxes. Teach family members to smoke only outside or away from the patient and oxygen equipment. Instruct the patient and visitors about the hazard of smoking with oxygen in use. Provide cotton gown and blankets. Synthetics and wool may generate sparks of static electricity. Avoid the use of volatile flammable materials such as oils, greases, alcohol, ether, acetone near clients receiving oxygen. Remove matches, lighters, ashtrays, and any friction type or battery operated toys or devices from bedside. Be sure that electric monitoring equipment, suction machines, and portable diagnostic machines are electrically grounded. Locate fire extinguishers and oxygen meter turn off lever. Okay, let's review. This is an embo bag. This is a face tent. This is a Venturi mask. This is a oxygen. This is a partial non-rebreather mask. This is a partial rebreather mask. This is nasal cannula. Always be aware of the importance of oxygen therapy. Be aware of different type of oxygen delivering mode. Keep the patient always comfortable when on oxygen. Always maintain safety when using a portable oxygen cylinder.